The Maryland Poison Center is a service program of the University of Maryland School of Pharmacy. The program has been in operations here since 1972. In that first year of operation, it was a very different kind of a program. It was really a referral service for physicians that were looking for assistance in how to manage particularly difficult cases, and it was sort of like a clearinghouse to try and connect physicians to experts in dealing with lead poisoning or things like that. In that first year, I think we got about 5,200, 5,600 calls, so it was a very different program than what it is today. Today, the program is part of a nationwide network of poison centers where it's a nationwide number that you can dial to get connected to a clinician that can help deal with whatever kind of poisoning related problem that you have.
The Maryland Poison Center is the place that you call when somebody has gotten into something either in an amount that they shouldn't or in a way that they shouldn't. And that somebody can be anybody, any age. It can be a little kid getting into a cleaner or into their vitamins. It can be an older adult brushing their teeth with Bengay, making a mistake with their medicines, and everything in between. The specialists here are pharmacists and nurses, and in addition to their basic training as pharmacists and nurses, as healthcare practitioners, they undergo intense training in toxicology. So they truly are the most qualified people to answer poisoning and overdose calls.
Poison Center, how can I help you?
In many cases, we're able to manage the call at home without having to go into the emergency department. Obviously, it depends on the scenario, and we'll be able to help the individual make that determination, because nobody else has that information, or people generally aren't trained in how to make that determination. We save lives by providing emergency triage and treatment information to anybody that calls. And we save dollars by not only keeping people out of the healthcare system that don't need to be there, but also to help the clinicians that are dealing with poisoning patients optimize care for that particular patient. And doing that collectively over tens of thousands of cases actually does result in shorter duration of hospitalization, lower healthcare costs, improved outcomes.
Just like any other field of medicine, toxicology is ever changing. We're the ones with the most up-to-date information. We have the latest literature, so we can provide those trainings to healthcare professionals to keep them up to date on the current trends in toxicology.
Well, one tablet is not a problem. We don't worry about one. If we had a large number of tablets of iron, or we were unsure of how many he got into, we may have to send him into the ER. But with just one, you may have some mild stomach upset, but nothing too complicated beyond that.
The center is there to help you. We don't judge, we don't get people in trouble. Our true goal is just to make sure that poisonings and overdoses are managed in the most effective and best possible way to get the best possible outcomes for patients.
When you're calling the Poison Center, you're actually doing the right thing. You're getting connected to an experienced health professional whose background and training is specific in managing poisoning overdose cases. So you're getting connected to an expert 24 hours a day, 7 days a week. Just call.
Alrighty, and if you have any questions, just call right back. My name is Jen. We're here 24 hours a day, okay?